So thank you very much, ladies and gentlemen, for hearing us today. We're conscious that you have a very busy meeting, so I will keep my comments brief. Just to be clear, I am videoing our presentation just because this is part of our accountability back to civil society through social media systems. But as soon as I finish speaking, I will turn it off so that there is no recording of your meeting. The NGO Delegation produces a report each year that speaks to the issues that are contemporary within HIV civil society at that point. Last year, the civil society briefing, or the NGO briefing, focused on stigma and discrimination, and I think was very positively received and acknowledged as speaking to the context within which HIV prevention, treatment, care and support takes place. This year's report takes that conversation one step further, and particularly recognising the backdrop of the Global Commission on HIV and the law. The NGO delegation has this year focused on legal issues and HIV responses. The way we have undertaken the survey is with leadership from the NGO delegates and alternates, but also with support of other civil society partners. We have undertaken 27 focus groups around the world with people directly affected by HIV on the front line. Within those focus groups, 248 people from a range of different communities were involved in a series of guided conversations about the interrelationship between legal issues and HIV. There were 10 core questions that people work through, but these generally can be grouped into three areas. Firstly, the knowledge and experience that the people brought of the legal environment. Secondly, people's personal experiences of interacting with enforcement systems and their engagement with laws relating to HIV or impacting on HIV. And I think importantly also looking at how communities or people on the ground respond and cope with those legal environments. So the key findings can be broken down into four areas. And I think some of this isn't going to be groundbreaking for you, particularly as we've just been talking about the investment framework and the impact of criminalisation that is recognised very much within the investment framework. But firstly, the key finding is that HIV-related stigma creates an environment that encourages punitive laws rather than protective laws around HIV. So the legal environment for many people is one that is punitive rather than protective. And that's significant because punitive laws and policies undermine the HIV response for two key reasons. Firstly, they prevent and discourage people from engaging in HIV services, so all the investment we make then is undermined by the criminalisation or the punitive laws that undermine that process, but also it impacts on people's uptake of services and people's continual engagement in those services. Stigma and discrimination, and then its more impact within laws can actually push people away from sustaining their engagement with HIV services. And that can lead to people dropping out of antiretroviral treatment and all those things that we know help with the HIV response. Thirdly, our report shows very clearly that legal protection are insufficient, and even where they exist, they're often unenforced. And therefore, many of the communities affected by HIV, their experience of the law, of law enforcement is a negative one. So people don't see, as we've already said, law enforcement as something that supports them or protects them, but they see it as a punitive issue that is often hampering their engagement in HIV prevention, treatment, care and support. And that's compounded by our fourth finding, that actually people on the ground often don't know their rights. People in highly marginalised communities and people who are affected by HIV around the world are often unaware of the legal protections that do exist, which then compounds their experience of engaging in a difficult legal environment. So given this, we are making four recommendations to you. Firstly, and to you and AIDS. Firstly, that we should really start to support anti-stigma and HIV education campaigns that accept that stigma is very much part of the issues that people are grappling with when they are trying to manage HIV prevention. And we can't just talk about HIV education without understanding that wider context. And we hope that with greater education that will increase and help both with increasing protective laws, but also helping with the enforcement of those protective laws. So generally, and particularly in the investment framework, as you just heard about, there is a key recognition of the needs of key populations, those people at the centre of concentrated epidemics around HIV. And therefore we call for the opposing and repealing of laws that criminalise HIV non-disclosure, exposure and transmission, but also laws that affect the key populations, such as laws against homosexuality, laws against gender variance, laws against sex work, and laws against people who use drugs. We call for a fostering of protective laws and also a knowledge of the protective laws and human rights within the justice system. So it's both about having that protective framework, but also about educating people to understand what protections exist so they can better utilise them in their struggle for effective HIV treatment, prevention and care. And finally, in our recommendations, we would encourage the supporting and promotion of programs to help people understand their rights and laws, and also then help civil society access justice. So this then leads into a series of decision points, which we understand will be something that we will debate and dialogue with people up until the PCB and then beyond. So our decision points start off with arguing for the need to integrate key human rights-based programs into national AIDS strategies. Now, you can't consider HIV strategies without an understanding of the wider human rights context. We believe there should be a repealing of HIV-specific laws that criminalise HIV non-disclosure, exposure and transmission. Specifically looking at people who use drugs, we believe there should be a repeal of criminal and administrative liabilities for drug use and for possession of drugs for personal use. So very much first focusing on removing the punitive laws from people who use drugs rather than more grandiose drug law reform agendas, but also looking at the need to adopt laws that support harm reduction in terms of needle and syringe programs and opiate substitution therapies that remain criminalised in certain national settings. Moving on to sex work, we believe there need to be steps taken to decriminalise sex work, both by removing laws and policies that prevent sex workers from accessing safe places to live and work, and also looking at the impact that these have on reducing, or the criminal laws have on reducing the access to health services, justice and labour rights for sex workers. Next, we believe that the decision point argues for us to take steps to repeal laws that criminalise or punish consensual same-sex behaviours among adults, so particularly looking at the MSM community, but no, looking at the wider LGBT community too. We also believe there should be particular protections for people living with HIV around their sexual and reproductive rights, which again is something that our report highlights continue to be hampered on the ground. And finally, specifically with regard to UN AIDS, we make two decision points. Firstly, we call for UN AIDS to work with donors and member states to ensure the strengthening of legal literacy programs, and specifically to increase funding to NGOs that provide legal aid programs. So this is about bringing greater legal literacy on the ground and really helping the people most affected to understand the laws that could be used in their benefit. We also call on UNAIDS to support member states to review national policy and develop guidance and tools to address the needs and vulnerabilities of all populations at risk. And we believe this work should be held within the UBRAF process and should therefore be reported back on the first annual review of UBRAF. And that's it. I was told to be quick and short, so that's what we've tried to be. And thank you for your attention.